Welcome everyone to the Birth Neoterist space. I'm your host, Sabia Wade, and I'm here to have such a good conversation because honestly, the topics that we talk about is like a daily thought thing, everything for me. But I would like to introduce my guest, Amy. Amy, would you like to introduce yourself in whatever ways feel good for you today?
Sure. My name is Amy Chen. My pronouns are she, her, and I work as a senior attorney at the National Health Law Program in their California office.
So how's that going for you?
It's going okay. Um, I can say it, I guess in the context of this work, since 20, I guess I've been sort of kind of looking at Medicaid coverage for doula care since 2016. Initially, in the early years, really just looking at the possibility of rolling out Medicaid coverage for doula care in California, where I'm based. And then since 2019, myself and my colleague Alexis Robles Frede have been basically tracking what states across the country have been doing. So on our webpage, the Doula Medicaid Project, we have a state implementation tracker where we have been following, state legislation, other state efforts that come from kind of state Medicaid agencies. In other cases, there's maybe sometimes coalitions or groups of doulas on the ground who are getting organized and then doing advocacy with their legislators. So I think that work has been really interesting, and I feel like have learned a lot from what doulas and advocates and because every state is different. So I
Sure.
think learned a lot about sort of what has worked, what hasn't worked. Maybe some things work in some states that don't work in others. So I think it's been a really interesting few years and really exciting because now, as of right now in 2023, we're at a place where over half of all states now have either implemented coverage, are in the process of implementing Medicaid coverage for doula care, or have taken some adjacent action. So, like for example, maybe they've set up a doula advisory committee to start working on it. In some states, they've maybe started to look at what the credentialing process would be like for doulas to be eligible for reimbursement. In some states, there's maybe been like a doula coalition that has come up that has started doing advocacy as well. So I think that's super exciting to see that there's so much happening across the country.
Can you give us kind of like so from my understanding, so just to kind of give people kind of a little summary,
Mm-hmm.
um, doula, so there's Medicaid, obviously, which is usually
Mm-hmm.
for low income folks.
Mm-hmm.
And so there's been a lot of initiatives across the country to end like programs that allow doulas to be reimbursed through Medicaid so that people who are low income marginalized communities are able to access doula services.
Mm-hmm.
Um, and so I think like generally speaking, like, in my opinion, like that's great, right? Like we want to be able to create access for birthing people, but we also want to be able to create employment opportunities for doulas because a lot of
Mm-hmm.
times like doulas are unable to maintain this work or sustain this work. But there's also been some challenges in this process. So I would love to hear like your thoughts on some of the like main issues that you see as challenges in this process.
Yeah, I think that's totally true. And I think at the National Health Law Program, our efforts are really aimed at trying to make sure that the sort of Medicaid coverage for doula care programs that are passed are equitable and sustainable and inclusive, not just for the Medicaid enrollees who are getting the doula services, but also for the doulas providing the service, right? Like, I think in a lot of states, so I could say I think there's a few kind of common challenges that have come up. One that I'm sure that I'm sure your followers are familiar
Hmm.
with is around sustainable reimbursement rate, right? So
Hmm.
in many, many states, the Medicaid reimbursement rates across the board, not just for reproductive and sexual health services, but like, in other areas are just low. Like Medicaid rates are often very low. And so particularly in this context, right, if you're asking, many of the Medicaid coverage for doula care programs are really have a focus on culturally congruent care for the Medicaid enrollees. And so I think you really create really creates a problem, right? If you are
Mm-hmm.
rolling out a benefit that is intended for Medicaid enrollees, you want it to be culturally congruent. You want people to be able to come from the community to serve their community. But if you're not paying them enough, it's not going to be sustainable, right? So we already know that, doulas, it's hard work to be a doula, right? So some doulas burn out. Um,
For sure.
many
And many doulas burn out.
Many doulas burn out, and a lot of doulas, a lot of doulas love the work that they do, but have to take on second, third jobs in addition
Mm-hmm.
to their doula work in order to, um, just in order to feed their families and put food on the table. So I do think that, that being said, the sort of idea of Medicaid coverage for doula care, I really think that states have an opportunity to think of this not just as a way to address maternal and infant health in providing those doula services, but also to really think of it as like a community development, workforce development effort, right? So like, even in states that already have a ton of doulas, like here in California, where I'm based, there are a lot of practicing doulas, but the reality is that the majority of those doulas are likely not going to seek to serve Medicaid enrollees for a variety of reasons, right? They have their own clients. In some ways, the Medicaid population may be a little bit more challenging or have different needs from sort of like the private pay clients. A variety of reasons, but the reality is that in order to adequately serve the Medicaid population in any state, there's going to need to be a pretty substantial sort of training and workforce development piece where you're going to really need to bring in new doulas to serve that population. I think the
For
good thing is
sure.
that probably just because doula care being what it is, my guess is that a lot of those doulas are really going to be kind of committed to that work in a real heart sense, right? This is going to be work that they're going to feel like they have a calling to do, and they really want to serve their community. But in order for them to do that, and in order to keep it as a sustainable workforce, the reimbursement rate has to be sustainable, right? So I
That
think
part.
one good thing is early on, many of the states that first implemented coverage, the reimbursement rate was very low. I tell this story because it is, the rate is so abysmal that it's almost laughable. But like when Oregon first rolled
Mm-hmm.
out paid coverage for doula care, the original reimbursement rate was only $75. Literally, like, I'm not missing a zero, and even if I added a zero, that's still not equitable, right? So they later raised it to 350. And then just last year, this was after several years of coverage, they raised it to 1,500. And so I feel like
Mm-hmm.
it really, I really like telling that story because it's sort of an arc from this $75. They struggled for years to get doulas to enroll. They struggled to roll out the benefit. It raised to 350. They were still having those same challenges. And so I think Oregon is really sort of serves as a lesson learned for other states where they had a low reimbursement rate. They were not able to get the workforce that they needed. People were not able to sign up for the benefit because there were not enough doulas. And I think because of that, the state really was like, well, we really, in order for this benefit to be successful, one of the things we really need to do is raise the reimbursement rate. And they finally did do that. And
And like
so,
in that effort though, like in that effort, because I think like a lot of when we talk about because for example, in California,
mhm,
the reimbursement rate, we just started in California
yeah,
with Medicaid reimbursement. And I don't know, for me, it's been several different types of issues as a person who runs a nonprofit
mhm, mhm.
in San Diego. So some of the issues is obviously the original reimbursement rate. We were like, no.
Right, right,
Right?
yeah, right.
Right. So
It was
then it
seven.
got
I think
raised.
it was 450. The original
Yeah, it was
reimbursement was like
450. And
450.
we're like,
Yeah,
this is California. What?
yeah, right. Insulting.
Um,
Yes.
insulting. So now it's been raised and like, okay, cool. Still could be raised higher, right? Like there's still
Hmm.
very much room for growth. Um, but some of the issues that we have also seen is one, like the the actual timeline of reimbursement. So when do we actually get the reimbursement? And historically, like, anything that's a reimbursement can take a while.
Yeah.
But like for us originally, before the reimbursement was applicable, was the thing, we would actually pay our doulas every 2 weeks. Like they knew every 2 weeks they would get what they need to do.
Mm. Hmm.
And then with this current system, we're like, especially as a nonprofit, we're like, we don't have money sitting around to just pay people and then wait for reimbursement, right? So that's been kind of a thing around like when do people actually, even for private doulas who are doing Medicaid reimbursement, how long will it actually take for them to get reimbursed? Especially if we're talking about culturally congruent doulas because they sometimes are just like the people that they serve, right? Like they're living
Hmm.
paycheck to paycheck. They're dealing
Hmm.
with other intersections of other, difficulties and challenges in life. So that's been a thing. Another thing that has been also a challenge for us is the actual process of enrollment to
Hmm.
get doulas enrolled. And so we as an organization we have been like helping people, like manually helping them, sitting down with them, doing virtual sessions, helping them sign up, do the thing, especially for people who have language barriers, who have like, different things like that. So like that's also been like a task that we did not anticipate, but also we don't necessarily get reimbursed to do,
Yeah. Hmm.
right? So
Hmm.
so like
Hmm.
so there's that. So just naming like, like this process, as good as the intention is, right? Because I think the intention is great. I think
Hmm.
that all people deserve access to doula care. It's also been very complicated
Hmm.
um
Hmm.
in this process. Even the pathways to getting certified can be complicated. Like the experience pathway can be complicated, the training it's just it's been a process. So I guess like with that being said, like what do you hope for the future of this process with Medicaid and doulas? Like where would you like to
Yeah.
see this go? What would you like this to look like if you could just be as dreamy as you can,
Hmm.
and how this
Hmm.
can look?
Yeah, so I would say, one hopeful thing is I have seen, even in states that just rolled out Medicaid coverage for doula care in the past year or two, I am seeing even some of those states introduce legislation to increase the reimbursement rates. So I feel like there is a growing awareness that, um, as we've discussed, in order for this to be sustainable, in order for it really to be equitable, in order for this to be something that really supports community development and workforce development in addition to maternal infant health, the reimbursement rates have to be raised, right? So I would love for, 1,500 is great. That's what they have in Oregon. Rhode Island started at 1,500. I would love for that to be a starting point, right? And not the max. 1,500 should be like a minimum, and states should really go up from there. The
Mm-hmm.
reality is in many locations, doula care costs. I have three kids. I've had doulas at all three of my births. I paid out of pocket between $1,500 to $2,000 each time.
Mm-hmm.
And so many of the rates are 2,000, even up to 3,000. And especially for the type of care that we're asking these doulas to provide for Medicaid enrollees, a lot of times the postpartum appointments are going up to a year after the birth, right?
Absolutely.
Um, and
Mm-hmm.
so we really have to start thinking about making those rates meet the amount of work that the doula is providing. So I will say, I mean, in terms of, what is my hope? I think in addition to sort of higher and sustainable and equitable reimbursement rates, and I think people in general, both states and legislators and state Medicaid agencies kind of getting on board with that. I also think that one other trend that I've seen that is exciting is um, legislation around doula care in the private insurance context as well, right? So one state that I like to kind of hold up is Rhode Island, because when Rhode Island passed their legislation, it was for doula care both in Medicaid and at private insurance. It was both Medicaid and private insurance, and the advocates that I've spoken with in Rhode Island have said that their specific goal was to address Black maternal mortality and morbidity in the state, right? And so we know that if you look at the rates of Black maternal mortality and morbidity, those stay steady regardless of socioeconomic status, regardless of income. And so if you're really looking to address Black maternal health, for Black pregnant and birthing people, you can't just do it for those who happen to be low income, right? You have to do it across the board. And I think Rhode
Mm-hmm.
Island was very explicit about that. And so I think it'll be, and so I've seen just this past year in 2020, a little bit in 2022, and then increasingly in 2023, there's more states that have also been introducing legislation on the private side as well. So I think I would love that. The other thing that I've been seeing is, right now it's really a challenging time for reproductive and sexual health more broadly. There have been a lot of attacks, obviously, most prominently against abortion, and increasingly also even against contraception and family planning. I think that being
Mm-hmm.
said, right now, sort of addressing maternal health, saving the lives of moms and babies, that is still something that is bipartisan, right? Republicans and Democrats are able to get behind that. That being said, I really, one of my hopes though is that, as we get more people who are interested in and invested in addressing, really truly addressing maternal health, my hope is that it sort of helps people realize that, right, our reproductive lives don't take place in a vacuum. And
That
so
part.
exactly, right. So like if you're interested in birth justice and doula care, you can't really separate that birth justice from reproductive justice, right? So you can't separate the autonomy and decision making about our bodies when it comes to pregnancy from autonomy and decision making about our bodies when it comes to other areas, abortion, contraception, family planning. So I'm really hoping that with the growing interest in addressing racial disparities in health, that this really has an impact on hopefully how our partners view kind of reproductive justice more broadly as well.
I have a question that just popped up in my mind that I would love to like get your thought about. So next year, which is like really close, we're like entering into
I
another
know.
election year.
Yeah.
And it's like like I was already like, wait, next year is like almost already here. Like that's wild. Then I'm like, oh shit, it's an election year. Like, and things are already, pretty wild, just like in
Hmm.
our
Hmm.
overall like state of being, right? But
Hmm.
I was wondering if you had any thoughts about like how this election year could impact the work of like doulas and Medicaid. Like, do you think that it will be some impact? Like, will we feel that impact? Because I feel like
Mm.
right now we're
Hmm.
kind of like
Hmm.
in a
Hmm.
space where I am seeing some states increasing the amount, the reimbursement. I do see some states very interested in doula care, very, but I'm like, will that shift? Or I guess just what's your thoughts about how that this next election year could possibly impact the work that we have done and are aiming to do specific to this work?
Yeah, that's a great question. I mean, I can't read the tea leaves. Who knows what's going to happen in
Mm-hmm.
2024? I feel like every single week, there's something new that happens with, whatever something new is coming out about Biden or about Trump or about DeSantis. So like, who knows, right? Like I'm not going to read the tea leaves there, but I do think that, I guess one thing that I'll say is that I feel like abortion has been such a flashpoint politically and also for like local and state elections since the Dobbs case came down, just a little
Mm-hmm.
over a year ago in June 2022. And so, one thing that we did see immediately after the Dobbs case, and I think in the several months since, is a lot of anti-abortion politicians have said, oh, well, now that we've banned abortion, we are really going to provide more support around pregnancy coverage and around maternal health. And I think it remains to be seen. So, like, I guess the big question for
Mm-hmm.
me, like, is that just lip service, right? Are they actually going to provide funding and services and programs to actually support all the additional babies that are going to be born because they have banned abortion? And I think this remains an open question for me. I feel like I remember seeing one article. I feel like maybe it came from Guttmacher, the Guttmacher Institute,
Mm-hmm.
that actually looked at some of these states where abortion has been banned and whether or not, when there have been uh, clear potential legislation or clear programs on the table that would have expanded access for around maternal and infant health, have those states done that? And my recollection is that the article said no. So I do think that this is a moment where, given that that has happened, and given that, sort of given the situation that we're now in this post-obs era, what are ways that we can really genuinely support maternal and infant health? And, how can we really hold the feet, how can we really hold politicians' feet to the fire and ensure that they're doing what they say they're doing, right? Are they expanding access to Medicaid coverage for doula care? Are they expanding Medicaid? Are they expanding 12-month postpartum coverage? Right? Are they providing other benefits and improving existing programs? So I think that remains a question. The other thing that I will say is that, as you know, last year, the White House, the Biden administration issued this maternal health blueprint. I think it was sort of, sort of like the first kind of comprehensive blueprint that we've seen from the executive level that is really addressing the maternal health crisis. I think there were a lot of pieces in there that were explicit, about addressing maternal mortality and morbidity, particularly for Black pregnant and birthing people. And there were pieces in there about supporting expanding access to doula care. So I think now, as some of those pieces are rolling out over this next year, I think it's also an opportunity to really see, again, is the Biden administration, and obviously I think Kamala Harris Vice President Harris has also been upfront about Black maternal health crisis, Black maternal mortality. And so I think on really both sides of the aisle, it's an opportunity for us to say, well, you all said that you would do all these things. You all issued this blueprint. So, where's the
What are we
there there?
doing?
Right, exactly. So again, like, I think there's a lot of opportunities, but I think it remains to be seen, what actually happens, like what actions are actually going to be taken.
Yeah, for sure. I think we're all kind of like in that space of like, ugh. Like,
Yeah,
don't
I know
know, but like aiming
it's
to be hopeful.
uncomfortable.
But
Yeah, it's
yeah,
like
and I
waiting
think
for
like
the other
with
shoe to drop. Yeah.
exactly, and I think even in this like aspect of Medicaid and doulas, it's like it's still there's still this like inner community work that's being done in these processes to be like, hey, this is not enough money. We need to work together to show that like we are here as far as doulas and we do want to do this work with our community, but we also need to be sustained in this process.
Hmm.
And we also have to have input in how this process goes. Because as doulas, like I think one of the if I was like an overall challenge that I've seen is like doulas, like, insurance companies, Medicaid, whatever, aiming to put doulas like in a circle that we don't fit in, like we're a square trying to fit into a circle, right? The
Mm-hmm.
way that we
Hmm.
practice is not
Hmm.
like, oh, we have a 15-minute session and then we're gone, right? We're like, no,
Right,
this
right.
session could be 2 hours, it could be 3 hours, it could
Hmm.
be that I'm at a birth for 2 hours, I'm at a birth for 2 days. Like
Yeah.
it could be, right? And I think like one of the biggest challenges is like making the reimbursement make sense for that type of flexibility,
Hmm.
that type of consistent continuum of care, that type of, like you said, especially working with marginalized communities, that there's always
Hmm.
these other intersections and systems that are, a part of the conversation.
Hmm.
And like, my hope is that, the reimbursement rates and also the timeline of people receiving their reimbursement can improve.
Hmm.
Um, but there's hope and there's people doing the work like yourself that, gives me hope and like, okay, we can get this somewhat right. It's not gonna be perfect, 'cause nothing's perfect, right? But like that we can get it to a decent space where, like you said, it's not just about caring for birthing people, which obviously is a focus, but we have to make
Hmm.
sure that the practice of doula work is sustainable for the people providing the care, right?
Hmm.
Like there
Hmm.
is no doula care without the doulas being able to do it in a balanced way.
Yeah.
So my last question for you is, in all of this work and all the things that you do, how are you taking care of yourself?
Oh, that is such a good question. You know, uh, I run, I go for runs, which is really funny because, as a child, I was like super unathletic. I could never catch the ball, really bad hand-eye coordination. So I was just like not athletic. And so I think my whole family was kind of surprised when I started running in law school, really just to stay sane. I really hated law school, hated the whole experience, and
Hmm.
think like having some physical activity kind of helped me. So now I continue to run. I live in Southern California and I actually am very heat intolerant. And so it's hard for me now because it's the summertime, so I have to run really
Yeah.
early in the morning. But I feel like that really helps me. Just something about like kind of the rhythm of it. I actually can't work out in a gym. Like I can't be like in a
Hmm.
space, like I feel like I have to be outdoors. So I think it really works for me. So I feel like that's what I've been doing. I've been trying to do it. I kind of took a break this summer because I was doing some traveling. And so I didn't run for like, I don't know, like a month or two. And so just been starting to get back into it over the past few weeks. So
Running is
yeah.
something that I wish that I could do, and I'm like, yeah,
Yeah.
no. But I'm glad that you're doing it. I'm glad that it works for you.
Thank you. Thank you. Thank you.
So I wanted to thank you for your time, for your energy. I also want to thank you, like, can you please tell people how to like sign up to get the updates that you all send?
Oh
Because
yeah,
those updates
yeah.
are so helpful.
Yeah, for sure. So let me see. So, everybody, you can feel free to go to our webpage. It's kind of hard. The URL is kind of long, but if you just Google
Hmm.
Doula Medicaid Project, I work for the National Health Law Program. So it'll be healthlaw.org. I think it's healthlaw.org/Doula Medicaid Project. You can also email me. My email address is just Chen, just my last name, CHEN at healthlaw.org, healthlaw one word, .org. And I have monthly updates that I send out around what's going on around Medicaid coverage for doula care and other efforts to expand access to doula care across the country. It's great because the listserv is so big now. So I'm basically just collecting um, updates that people want to send out. I'll send out an
Hmm.
email about a week beforehand. People will send me the updates. And I think now the listserv is quite big. And so I think it's a great way
Hmm.
to get resources, to get events, to sort of get the word out about what's happening in different states. And, hopefully, I hope it's been helpful. I think just really
It's been
trying to have
so
some sort of
helpful.
community so that people know what's going on.
It's been
Um,
so
yeah,
helpful. We like did a post and we like just summarized some of the things and like, led people to that space because it's been so helpful to see everything in one space. Like
mm-hmm.
to see what other states are doing, how they're moving, possibilities for the state that you're in, like it's super helpful.
Oh, good, good. And we're trying to, I think pretty soon I'm going to be working with a designer to try to find a way to get those basically like an archive of those on our website because I feel like that'll be helpful too for people to be able to
Hmm.
see, oh, like what did I miss last month or what have you. So,
For sure. Well,
yeah.
I thank you for your time. I know that you are busy, but I appreciate this, and I'll definitely will put links, we'll put everything so that whoever is listening, who has interest in at least sign up for the listserv because it's super helpful, will be able to get that information.
Yeah, no, thank you so much. Thank you so much for having me. I had a really great time talking with you and really grateful to be able
Thank
to share this
you.
space with you.
Thank you. Have a good one.
You too.
Later.
Bye.